Today we're going to be doing our 5-minute dental implant. The patient has plenty of mandibular ridge. It's probably a good 20 millimeters wide. We have a panoramic mounted that shows that we have at least 15 millimeters between the top of the ridge and the inferior alveolar nerve. So we're just going to go ahead. This little gadget here I've got in my hand, this is a dermal punch made by Miltex, and what we do is we melt it. So I melted it into a 90-degree shape, which fits perfectly in that position. These come in 3, 4, 5, 6 millimeter sizes. I'm going to just mark my spot. Let me know if you feel anything at all, okay? There we go. We just mark the position where that implant's going to be going. This is a minimally invasive technique. We're not flapping. We're just going to remove the overlying gingiva, and I've got a perfectly round. And now we're going to go ahead and start with our implant. You're going to taste some salt water here, okay? I'm going 1,000 RPM. This is Hyosin's ET3 system. If you feel anything, let me know, okay? There we go. We're going to be placing a 5.0 by 10, which means I have to use 4 drills. This is the start of their conical burrs. These are depth cut. They're set for depth. So you don't need to worry about going too deep. I'm going to stop 1/2 millimeter short of my goal, which is their 4.5 by 10, which is what I just did. So we're ready to go ahead and put our implant in. And this is the 5.0 by 10 Hyosin ET3 implant. And we're just going to hand place that all the way down. I like to countersink these in the posterior about 2 millimeters. That makes sure that when we go ahead and restore this, it looks really natural coming out of the gums. And what we're left with, this is the carrier that comes on the implant from Hyosin. We're going to go ahead and remove that and just place a healing cap. And we're all done. Now you do have to be careful with these Hyosin dental implants, and they're 3.5 size. They call that their mini. It's a full-size dental implant. It's just a little smaller than the regular platform. The 3.5 millimeter carrier is a little bit weak, and we usually won't hand driver that in all the way. Good. And you can see what that healing cap does is by going a little bit larger than our osteotomy, it stops all the bleeding. It acts as a pressure cuff. So that's great. So the patient has no stitches, no bleeding, and no cutting. So we're all done with this, and that took less than 2 minutes. We call it the 5-minute dental implant just so we have a little bit of wiggle room in case we want to choose a different dental implant or anything. And Michelle, go ahead and take a PA and we're all done.